Dr. Quattromani received her medical degree from the University of Perugia in Italy and did her residency at Washington University in St. Louis. She is board certified in cardiovascular disease and specializes in cardiology, electrophysiology, and pacing. She was drawn to POTS after her daughter was diagnosed with it. Dr. Quattromani diagnosed and treated POTS patients for many years here in St. Louis before becoming a civilian cardiologist at General Leonard Wood Army Community Hospital in Central Missouri. Please join me in welcoming Dr. Antonella Quattromani.
Thank you very much. It's a pleasure to be here, of course, and see my patients, even if I don't treat all of you anymore, but some still do come all the way to Fort Leonard Wood to see me. Really, it's an amazing opportunity to share my time with you. This diagnosis has become really a part of my work every day, and going back to my very first tilt table that we did when I was a resident, a fellow at Washington University in 1984-85, the original diagnosis of dysautonomia really was done in 1982. So we were really the early people that tried to treat patients with autonomic dysfunction without knowing much about it. Almost 30 years have gone by. Almost 12 years since my daughter was diagnosed with POTS. She's become a successful engineer and took a lot of work during the first 3 years after the diagnosis to make sure that she was able to function, especially since she's a construction engineer. My fear was that she was going to pass out on a scaffold and fall off.
The speaker is a little loud over here. It sounds mumbled or something.
Okay. Oh, yeah, sorry. Better?
Yeah.
Okay. So I just want to give a small and fast review of POTS 101.
The one on the right side.
Okay, great. So this is just a definition of POTS. It is a heart rate increase over 30 beats per minute from baseline, and in children we look at 40 beats per minute, and also in adolescents we consider age up to 18, 19. We see a lot of high school kids that come to me, even now at the military hospital, because they can't perform in sports due to the sudden increase of the heart rate, and they can't keep up with their teams, mostly track runners, basketball players, and so forth. So parents are concerned, the kids are concerned, and so we really see a lot of, fortunately, early diagnosis in the last probably 4 or 5 years. There's rarely or almost never symptoms of hypotension during the tilt table test. However, there are many other symptoms that happens when we evaluate these children and adults on a tilt table. All because our body is really regulated by the autonomic system, and there's two systems, the vagal and the sympathetic, parasympathetic and sympathetic tone that regulate our body. And basically, as I always try to explain to everybody, we have a thermostat in our body, and as you set your thermostat, so a certain heart rate, a certain body temperature, a certain blood pressure, and people with autonomic dysfunction are not able to maintain that homeostasis of their autonomic system. So you can have extreme heat or extreme cold. You can have increased heart rate for absolutely no reason. You can have lower blood pressure than what you expect. So really, it's almost like your thermostat is running out of battery. It's not working appropriately, and so it's hard to maintain that equilibrium. And you really have to put a lot of efforts in trying to balance this system, which affects your heart, your lungs, your bladder, your respiratory rate, everything that has to do with your normal body action included sleep. We see a lot of people that have autonomic dysfunction in POTS who have really difficulty falling asleep, staying asleep. So that's another big issue with POTS patients. This is a quick list of a lot of the symptoms that we see in patient that presents with autonomic dysfunction, or they just come to us because they've run out of resources. The primary care doctors don't know what to do with them. That's usually what happens in the military. They get seen by PAs or general practitioner, and then they just get sent to cardiology or neurology, but mostly to cardiology because of the tachycardia. And then you see fatigue, lightheadedness, frequent headaches, inability to tolerate the light. People are very anxious. They have nausea, they have constipation, and Dr. Weinstock will address later the GI symptoms related to postural orthostatic tachycardia syndrome. But I would say the first three are what usually present to me. And a very good thing is for us cardiologists to obtain a 15 days monitor on kids and adults, so we can actually see what the average heart rate does during the day. The new systems are very, very detailed, they're very easy to use. A lot of them look like a big Band-Aid. You can keep them on for 15 days. We give them to the active duty soldiers all the time, even when they're training. And you'll see these kids who have persistent heart rates around 100 or sometimes even 115. And when they exercise, they spike up to 190, 200, really very, very high heart rates we see. So there are ways for us to, even without doing the tilt, to see this inappropriate tachycardia that persists through the day. As I said, 82 is when finally POTS was brought up to an official diagnosis. The first recognition was actually funny to say, but in the Army. And most of the time we was told to the kids is not to lock their knees when they were in formation because they would pass out. But even now we see kids passing out because they can't keep up with the runs, passing out because their volume depleted. And that's one of the things that I will talk about later about POTS patients, is the relatively low volume that a lot of POTS patients have. So it seems funny, but people have to drink a lot of water. And if you're in a situation you're exposed to heat, temperature, work outside, water is your friend. Water and electrolyte supplements are your friends. These are other presentations of different patients we've seen over time, passing out or almost passing out. Hypermobile joints, which is another co-diagnosis that we see with EDS and patients with autonomic dysfunction. Palpitation is 100% there all the time. We also see brain fog. People seem having difficulty concentrating, short-term memories, and things of that sort, which affects students in particular. Whoever has children that were diagnosed with POTS, we try to help them by having homeschooling and homebound paperwork so the teacher can support their education by giving homeworks at home, giving them a program that they can follow when they can't go to school because they don't feel right. We also offer infusion, especially because kids tend to forget to drink water. So sometimes in our school district, they come at 3:30, and a couple of times a week we infuse a couple liters of saline so they can then play their games on the weekend. We have a lot of clients that come on Friday because they want to play softball or football or whatever during the weekend, and at least we're able to tank them up a little bit. Again, this is all about other diagnoses and different things that are associated with the POTS and how we get to the diagnosis of POTS. There is other forms of autonomic dysfunction, which includes visual syncope, malignant visual syncope, which we don't see too often, but you have patients that actually, when you put them on a tilt, they go flatline. and at that point, it becomes a serious concern about driving and having certain high-risk jobs. So in few but rare cases, we have recommended pacemaker implants even in very young patients. Unfortunately, in the military, if you have diagnosis of malignant syncope and you need a device, you are immediately medically discharged, which of course creates a lot of sadness in these patients. But I think, I want to point out that there is modality to diagnose these events, especially, as I said, with the new 15 days and 30 days event monitors, which are very easy to apply. And if anybody has not had a diagnosis or has some concerns about this, you can ask your cardiologist or your primary care doctors to do that. Again, the volume issue I would like to talk about for a few minutes. There is a fairly large number of POTS patients, up to 25%, who have plasma volume deficiency of at least 13%. So this is because there is an abnormality on the renin-angiotensin system, which is through the kidneys, and how you produce this hormone that keeps your volume up and increase water absorption. So in the POTS, this is not a normal response, so we do use fluids and IgG and other form of infusions for these patients. So again, the other thing to do is, we always talk about, is using, staying away from the heat and using routine exercise and support socks, abdominal binder, anything that will help you compress the venous return and bring you more fluids. So again, some of the devices are shown here. Compression socks are your friends, runner socks are going to be your friends, even if they don't look too cute. Girls can use compression leggings. Some of the company like Under Armour make pretty good compression system. And again, two other things that we find in association with POTS and autonomic dysfunction is the joint hypermobility, EDS syndrome, and the mast cell activation disorder, which is pretty common and is actually a complex thing to treat. It affects your GI and many other organs. We see patients that come in and they're flushed, they feel hot, the skin has almost like erythema. They have GI symptoms, poor tolerance to certain foods, diarrhea, constipation, and alternating. And they sweat, they wheeze sometimes, but mostly it's the bloating, nausea, and GI symptoms. Again, I'm not going to talk much about this because we have an expert in the room, but remember that the GI is one of the organs that will be affected by POTS. And mast cell is one of the symptoms associated with it. There's drugs that we use to help with the mast cell release symptoms. There's a big list right here. We don't have a GI person in our hospital, so I've kind of taken upon myself a lot of the treatment for mast cell release by using a lot of Quattromani-Pots. It seems to really use and be very helpful for these patients. So in conclusion, I think it's a very complex diagnosis. The physician and the patient have to be patient about coming to a point where you have reached a balance. And it can take time, it can take months, it can take sometimes years. For my personal experience, it took almost a year for my daughter to finally find a combination of beta blocker, GI medications. She had an endoscopy when she was 20. She had almost gastroparesis, so she was on certain medication for a while. And the diet and the exercise and a lot of the things that we recommend included, postural exercises like Pilates. If you have low tolerance for exercise that happens when you're standing, Pilates is a great thing. Increases your muscle tone and it's very helpful. Yoga is another of the things that we recommend. Patients with POTS tend to be, especially patients with hyperPOTS, a high level of adrenaline and tend to be running pretty high. So that's pretty much a quick review, and I'll take some questions later. And here I pass on the baton to Dr. Wentz.
Before we get too far into the program, I do want to do a few thank yous because I usually wait till the end, and we end up missing some people, so